Hi, I'm Anna, and I'm a doctor. So I hope you're watching this from the confinements of your home. And if not, you should probably go home right now. Help us to fight COVID-19. And to do this, you can take simple measures. Practice good hand washing techniques. You can also wear the appropriate protective gear, and then self-isolation. Now, I know that self-isolation sounds like a nuisance, but you know what's worse? Contracting as well as spreading the disease. So help us in fighting this disease. And finally, be responsible. If you're having symptoms, call the hotline and then go for testing. Help us to fight this.
Matthew Phyllis, your moderator for today, and also the Deputy Minister in the Ministry of Information, Communication and Technology. This morning in our session, we're going to discuss the topic around the reopening of our open markets and informal trading across the country, as well as access to water, specifically for the poor and unemployed residents of informal settlements during the state of emergency. To help me discuss this topic, I am joined by the Honorable Erastus Utoni, who is the Minister of Urban and Rural Development. Thank you very much, Honorable Minister, for joining us.
Thank you.
I'm also joined by Honorable Esther Mwinyangwe, our Deputy Minister in the Ministry of Health and Social Services. Always a pleasure to have you here, Honorable. And Her Worship, Ms. Francina Kahungu, who is the Mayor of the Windhoek Municipality. Thank you very much, Your Worship, for joining us. We also have in attendance officials from NAMWATER as well as the Ministry of Finance for any of the technicalities in the issues we are going to discuss today. As it is usual, I now invite the Honorable DM of the Ministry of Health to give us a brief update before we get into the discussion for today.
Good morning, and thank you, Honorable DM, for giving me the opportunity to update or to inform the nation on what is the current status with regard to COVID-19. The status remains the same. We are still standing at the 16 confirmed cases. We have 8 recoveries and 8 that are stable, and clinically they are also doing very well. With regard to testing, our 2 institutions, that is now NIP and Pathcare, received so far 929 samples, of which 802 were tested. And yesterday, 37 samples were tested, and we still have the 80 retests. Now, out of the 802 samples that they were tested, the 802 were tested, and out of the 802 that were tested, 798 came out negative. There are still pending results from Pathcare. With regard to our quarantine information, yesterday I reported that we were having 222 people in quarantine, but the number has increased now because there was a flight, West Air flight, that arrived yesterday from South Africa with 31 travelers. And all these people were also put in quarantine. So now our number of people in quarantine facilities at the moment stands at 276. So that is the update or the health update for this morning. I thank you.
Thank you very much, Honorable DM. Perhaps could you just give some more information on the people that were on this West Air flight? Are they Namibians returning?
Okay, thank you very much. Yes, these were mostly patients who were in South Africa or who went to South Africa for treatment. For example, we have a family of 3 where they have a 4-year-old who underwent heart surgery, and another person is also a cancer patient who went for treatment to South Africa. Then we have a child who was also accompanied by his mother when he went for surgery as well. So these are all people who have medical conditions, and they were in South Africa for medical consultations, and they needed to come back home.
Thank you very much, Honorable DM. Now getting to the discussion, we start with you, Honorable Minister. Of course, we know what prompted the closing of the open markets. In your analysis, in looking at the markets before and now, would it be justified to say that the markets are ready for reopening, and what measures were put in place to qualify them as being ready to be reopened at this time?
Yes, thank you very much. Maybe to start with, as to why prompt to reopen the open market. The government of the Republic of Namibia look at a number of factors or issues. Number one is that, the majority of the population who have a limited source of income, they mostly sustain their livelihood through selling of products at those open market. And, for them also to sustain their families, it's only when they sell, products at the open market. Yes, it was not an easy decision to reopen the open market at the time that the pandemic is affecting a lot of people globally. But now we also look at the situation in the context of Namibia, that, the COVID-19, of course, we are not 100% sure, but what we are saying is in our situation, it's slowed down. And that's made, the government to say, now, in order to reduce the burden of government, supporting, everyone, why can't we allow our people who are selling at the open market to at least to continue with the business? Because also, when you buy, products, more especially when we are referring of opening open market, we are referring at goods, essential goods like food. Now, food that are being sold at the open market, in some cases, these are cheap, type of food. For example, fat cake. You find it there at the open market. And you find that people, the contract workers in the construction industry, when they are constructing, buildings, so they opt to go to an open market and then just buy something quickly and then eat. So this is the reason why we said, no, let's open the open market to help the nation, more especially the low-income grouping of the society.
Thank you very much, Honorable Minister. Your Worship, I can imagine that before COVID-19, it would have been perhaps difficult to ask the traders at the open markets to vacate the premises in order to make any renovations to the place in order for it to continuously improve. Now, with this opportunity in COVID-19, has the local authority been working with or associations that have membership?
I must appreciate the opportunity for us to be here. Your question has kind of three parts. You asked the opportunity provided to us by COVID-19. Yes, in every situation, it can be as bad as it is. You have to look for opportunities. I fully agree with your question. We found an opportunity here that we get an opportunity to allow the traders or vendors to vacate open markets so that we clean them. Now the question, the measures in place. All our measures are based from the Republic of Namibia's measures to combat COVID-19. So what we have in place is exactly what it's given to us. And I have to inform you that yesterday, regarding to Oshetu Market, we were given the provisional approval from the Ministry of Health and Social Services, meaning that we meet the requirements, specifically basic requirements, which are needed to be in place for an open market to be opened. The third portion is you ask the cooperation or the working together with the traders, be it association or committees. Yes, from day one, when we heard that there is a proposal for open markets to be opened, we consulted intensively from all the markets. Lucky enough, they are already committee members. The traders themselves, they formed the committees, and in that you can regard it as association, although association it might be more legal, but we have traders committee which have been working with us on looking at ways and what is required from us to implement the regulation and to make our open markets working according to regulations given to us. And I have to inform listeners that so far the cooperation we received from our traders is very much commendable.
Thank you very much, Your Worship. Dr. Mwinyangwe, we heard from Her Worship that Ministry of Health is the last one to give a stamp to the reopening of any informal trading areas, including open markets, to, of course, allow that further infection or no infections occur in this area. So what are some of these criteria or requirements that the Ministry of Health has been very stringent about to ensure that the open markets actually reopen and that there is a system in place to continuously protect traders and customers that come to the open markets?
All right, thank you very much, DM, for the question. Of course, we all know the reasons why the informal markets were closed, because we know that informal markets, they can pull a large crowd of people when they are coming to buy or when they are coming to enjoy their kapanas and so on. Now, from our perspective, we want to ensure that public health and food hygiene is taken care of, is secured. That is very important to us as a ministry. And as my colleagues also have said here, that maybe because of COVID-19, there are opportunities now. And it's for us to fertilize those opportunities and make sure that these opportunities, not only during COVID-19, but they also now continue to practice public health and also to make sure that we have food hygiene at all times. So for us, it was important to make sure that the markets are clean and the hygiene of the markets, it's very important to us. So the following measures or requirements were put because we had a checklist and we wanted to make sure that we just go to the market, you inspect and you tick off from your checklist. So for us, it was very important that the markets should be disinfected. That was point one. And then also to make sure that it's not only the markets that are being disinfected, but the cutting surfaces are also clean and disinfected. Those areas, those places where these people are cutting their meat and so on. We wanted to make sure that we have water there, and all the abolitions are also in working conditions. And that is what I have said, that we wanted to fertilize these opportunities, because when we visited Oshetu Market, for example, which is known as the single quarters informal market, you know, you could easily go into the toilets and they were so clean, everything was replaced and so on. So cleaning and waste management practices, that is one of the requirements as well. And of course, we are talking about education. And education is important because for the informal traders, they need to understand, why are we emphasizing on hygiene? Why are we emphasizing on social distancing, for example? They need to know these things. So we wanted to make sure that health and public education is given to the sellers, and also for them to know how to handle their food. So we were talking to them, education and training was provided to them as well. Now we are saying markets are attracting a huge crowd of people. And we are saying one protocol that people need to adhere to is social distancing. Now, how do you make sure that at an open market where everyone is coming, social distancing is? That is why we first have decided the sellers should rotate so that we don't have a huge number of sellers coming at the same time to the center sell. But they were given a roster so that they can know who is selling on which day. That is one way of minimizing a crowd and also ensuring that we have social distancing. And then, of course, with the help of the city of Windhoek also, their selling spaces were marked so that every seller could know that this is my space. I'm standing in this marked area for selling, and the next one is there. That was one way that we also wanted to see. And if you go to the Oshetu market, you will see those marks. They are there. And even when people are entering, we have also decided that they will use one entrance and then the other one to exit. And at every entrance, there will be either water to wash their hands or hand sanitizers before they enter the market. And outside, as they are queuing up, something that we also see at any other retailers or shops, they are also nicely marked so that they can know who is standing where, and they are not standing in a queue. It's like a zigzag for them also to make sure that they are keeping social distancing. And then, of course, the placing of disinfectants into appropriate marked areas, for example, the entrance and exit areas. The placing of foodstuff in areas of selling, that was also one of the requirements. And of course, before issuing out the certificate, there was a final inspection to make sure that we as a ministry concerned about public health was really satisfied. And of course, we were satisfied, and that is why yesterday the certificate was issued. And of course it will not, and especially the issue of training and education, is not a once-off thing. It will continue. It is a continuous practice. And of course we will also keep on monitoring the place.
Utoni, Perhaps my question would go around, of course, one, protective gear for those who are at the market, if that is duly provided for to every trader at the market, perhaps gloves or any other disinfectants, but also secondly, a major part of hygiene, which is running water at the informal markets. Has this been attended to? And what then post-COVID-19, will this be maintained, or what is the situation there?
Thank you very much. Let's start with the question of hygiene at the open market. Is that the key now to all of us as a nation, that we need to keep our places clean? It be places, your house, it be a place of business like the open market. So what I would want to say here now is that, you know, seat of Windhoek, when it comes to seat of Windhoek, although I'm going to talk about the open market countrywide, let me start with the seat of Windhoek. Seat of Windhoek in the past years, you know, was regarded as one of the cleanest city in Africa. But we lost that status. Why? It might be because we, the responsible people in the office, were not taking care or serious attention towards the cleanness of our places in terms of, like, for example, open market. Now, when we are talking about COVID-19, we do not only want to talk hygiene just because of COVID-19. We want to talk hygiene for the next years and years to come. And we want to educate ourselves, the vendors and the customers. When they are visiting the open market, they have to ensure that the place is clean. Yes, in terms of sanitation, running water, yes, all local authorities, I spoke to them, and I've given directives that there will be no any open market in any given local authority to be opened if there is no supply of water. There are no sanitation. There are no sanitizers. So the leaders in the local authority have assured me that all these are provided for. So therefore, I'm now encouraging everyone to ensure that, you know, this open market, to me, open market are one of the big business. These are the business that drive the economy of any given country. So, you know, some of the people in the past years, they used to, you know, buy food from the open market. But as time went by, some of the people stopped. Why? It's because, you know, the place does not look clean. Now, I'm encouraging the leadership of all local authorities in Namibia that we should again bring back those customers who used to buy, you know, products at the open market. And we also want to ensure that tourists who are coming to Namibia, they should come and buy food or whatever type of product at our open market. You know, when COVID-19 came, when the COVID-19 came, so it was like places business activities like the open market should be stopped. Why? It's because the hygiene was not conducive enough, was not just good. So only some few restaurants were kept open. Now we are saying if anything again going to happen in the country in terms of maybe virus or whatever, they will find us well prepared and our place are clean. And we will not be told that no, close because of this. Because that we have prepared ourselves, our place are clean. So this is what I want to encourage, that each and everyone, local authority councillors, please ensure that these places are clean. The mask, yes, local authorities, some of them are providing the mask to vendors, and some of the vendors also themselves, they are buying vendors for themselves, and they are also providing this what we call not pirating, but it's an instrument where you have water, and then you just press with the feet, and then you wash your hand.
The tippy taps.
A tippy, yeah, tippy tap, something like that. Mm-hmm. Yes. So these are already made available at the open market.
Thank you very much, Honorable Minister. I'd like to remind the viewers and listeners at home that you can call in to the number 061 400 397, 061 400 397 to ask your questions around the topic we're discussing. But before that, now I want to ask Your Worship a question. We have, of course, we know that the open markets usually are made up mostly of traders that sell consumable products, which is mostly food. Clothing. Are they included in the new measures put in place on what products are to be sold at these open markets, and what does this mean for them? So what products are currently given the green light for selling at the open markets now that they're reopening?
Yes, thank you very much for the question. Maybe before I come to the type of products to be available at the open market, allow me to indicate that, to be specific, Oshetu market, in addition to that one, Soweto market, and all the markets, mostly, these are markets which came in existence because of money spent. These markets are there to help both council and residents. Say, forward, we must continue using our markets in a business way of doing business, because we spend a lot of money creating or building these markets. What I'm trying to say is, for example, sanitizers and other things, already in agreement with traders, we said we have to meet one another halfway, because it will not be fair nor correct for municipality, for example, of Windhoek, to be the only provider of all those. It is a requirement of each trader to make sure that for the trader, her or himself and the customers, she or he must also provide what is required for the business to continue and to prosper. Regarding the products to be sold, yes, our focus here is all essential goods. Here, we know very well that the majority of us understood that food is one of them. But we will not leave out firewood, because if you have to cook, you have to use firewood at the same time. Why do I mention firewood? I have to mention firewood because at our open markets, we have many traders who are selling firewood. So I have to mention it. Yes, second-hand clothes. It's something to be discussed, because some days ago, I listened to the Minister of trade, winter is about to approach. We have to think about jerseys. Must a person sell jerseys and jackets? For me, all essential goods are allowed to be sold, but main is on food products.
Thank you very much, Your Worship. We have a caller on the line, Elias from Windhoek.
Yes, good morning.
Good morning.
I wanted just to ask, what about the women and men that do domestic work? Now, they've been home for like a month, and some of them do not have the chances to get the 750 and maybe the other food distribution that's been going around. And for the construction workers, who also depend that as an income of survival. And also
a crisis. And the very same doctor that blew the whistle on the SARS, the severe acute respiratory syndrome in 2002, warned in Australia just a few weeks ago that we might have another pandemic in 10 years' time. What's your view about that? And secondly, Her Worship, if these informal traders do not also put their sanitizers and face masks on the table, as the municipality is doing, what happens to them? Do we bar them from coming to these markets? Thank you.
Thank you very much. We can get to responses.
Yes. Thank you very much for the question. The wet products sold in China, the market that you have just mentioned, you know, this situation of COVID, you know, came as a surprise to many people, even in China. And, you know, the Chinese government, when they learn that something is very serious, dangerous, killing people, they took some strategies. And then they removed the vendors from the open market, and then they started disinfecting the places. And then, you know, us also, far in Africa, we started to learn. It was just an experience that we learned also from China. Now, when we learn the situation about the COVID-19, we said, okay, to prevent that pandemic, not to spread places like our open market. This is now what we are talking about: sanitation. We are talking about sanitizers, running water, soaps, and, you know, clean places. So these are the information that will help to defeat the pandemic. Yes, it's true, the pandemic has done a lot of damage, but as we have learned, as I said, the experience of that. Now, these are the measures that we have just put in place. Yes, for the new pandemic to come, yes, we are going to learn, and we learn from others. And as information are going to disseminate it to us, that's the information that we can also disseminate to our community to protect ourselves. So we are in the learning process, and we are doing what is being required in terms of cleanliness, hygiene, and everything.
Thank you. Perhaps we can go to Your Worship. Question directed to you.
Thank you very much. Let me appreciate the question from, I think it's Kevin, Eagle FM. There is no moving backward here. There will be no moving backward to the old situation here. I have to use this opportunity to inform all of us that these regulations, as they are put in place during this period, there will be no chance in the future to change them. What can be changed is only a number of people to enter the open market, is only a number of people to visit a given business place. Cleanliness-wise, all requirements as they are available now, as they are in place now, that is going to be a normal standard to be used at any given open market. The question is, if a trader does not have all what is required from her or him, there are no two ways about it. Is either you trade or you don't trade. But also, Windhoek Municipality, as a caring council, we will assist where possible, because we understand this is the time when all of us have to get money to enable us to satisfy our needs, including buying food and other necessity for our houses. We will assist where possible, but we will make it a point and then will enforce that each trader, at least after you work even 1 week, kindly buy the equipment that are required to be in a position of each trader.
Thank you very much, Your Worship. DM?
Yeah, thank you very much. You know, the COVID-19 impact on the informal settlement, no one can dispute that. And especially when there was a need to close down the informal markets, who were the people mostly affected? I think in this case, women were mostly affected because women have the over-representation when it comes to informal markets. Now, if women are affected and they cannot sell, it's not only them, but the whole family, because then they cannot sell, they don't have any income, so the whole question of agri-food chains were also disrupted. Now, for us to reopen the markets, we were put in a very difficult situation because the livelihoods of families were affected, but on the other hand, you are also concerned about how do I keep the further spreading of the virus. So it was not an easy decision to take to open up, but we wanted to make sure that how do we control this? And that is why the first point was, let's look at the informal markets that are a bit formalized and where we have a structure. Because now you also have these people who are pushing their wheelbarrows, selling mealies and all kinds of things. They were not for now considered because it could have been difficult to control them because they don't have a specific place or locality where they are selling from. And we know that one reason of the lockdown is to minimize movements. Now, if you allow them to push their wheelbarrows and go from one street to the other, there's no way that you can control that. And I'm always saying that maybe COVID-19, and those are the opportunities that I have been talking about. Even the ladies who were, trading in front of or next to shops and so on, they were not for now considered because we were looking at those who are registered with the city of Windhoek. And maybe this is it's an opportunity for those who have been trading without formalizing their business by registering. It's an opportunity now for them to start realizing that there is an incentive, there is a benefit for being a registered informal vendor. So that is one opportunity for those who have never done that to start doing that now, because at the moment the focus is on giving those who are registered a chance, who have a place where they are selling from. Now, there was a question on Social Security and the 750, that where are we now? Some of us cannot qualify, and maybe I'm repairing televisions and so on, and now I'm not allowed to do that at the moment. I think the Social Security Commission, as well as the Ministry of Finance, have come up with a stimulus package. And I know that they were also here to try to see how can they also cover up for those who have lost their income because of COVID-19. So, and I think it's important that those people can also approach the two institutions, the Social Security Commission as well as the Ministry of Finance, and see where they can be, assisted.
Thank you very
Yeah.
much, DM.
We have another caller on the line. Hello.
Hello, good morning.
Yes.
Good morning, how are you?
Good morning. You may go ahead, sir.
Thank you very much. I think the mayor of the city of Windhoek has gone through what I wanted to ask with regard to the standard as from, post-COVID-19. But then the other thing I wanted to ask the Honorable Minister of local government is that, do we not think that the open markets in the capital city too less to cater for the inhabitants of the city of Windhoek? Why can't we construct more open markets? Let's say one like in the areas of Chomwise, where you keep the Commerce-Dal residents or Chomwise and the likes just on one side, and then you construct a similar one in the areas of Okanja Park. This will, in my opinion, avoid people flocking to the Shetus and the Vanandas and all this. That's all I wanted to say for now.
Thank you very much for that. We have
Thank
another
you.
question from a media practitioner. Yes, sir.
From Namibia Press Agency. My question is going to the mayor. I just want to know how much does the city of Windhoek make from this informal markets, because we know that they pay monthly rental fees. And how much did you lose during the lockdown from these informal markets? Thank you.
Thank you very much. Do we have any other questions from any media practitioners? Do we have any other questions from any media practitioners?
Hi, I'm Jonathan from the NBC. I want to know what have government done in the month of the state of emergency to ensure that people living in informal settlements have access to potable water after the pandemic?
Thank you very much. All questions to you, my panel. Honorable Minister, perhaps you could start with
Yes, thank you very much. On the first question, I really like the question that we, more especially the city of Windhoek, but not only the city of Windhoek, I'll extend that most of local authorities, as I was saying, this type of business is the most important business in a country. If you upgrade this level of this type of business, you help the economy of the country to grow. Yes, coming back to a city of Windhoek, for your own information, the information that I have is that city of Windhoek have a total number of open market. There are 18. Now, this time of COVID, the city of Windhoek wanted to open all these 18 open market. But due to the problems that are there at some of the open market, they are not going to be opened now, because some of these open market need to be repaired, need to be disinfected. You need to do a lot of work. Now, as I'm talking to you, there are only 4 open market that are going to be opened, I think, during the course of this week. And then other open markets will be opened gradually. Yes, in the next few weeks to come, because it's not also an easy thing, because it's costly. It involves a lot of money. Yes, it's true, it cannot cater. These four cannot cater for such a big population like in the city of Windhoek. And this is what I've already mentioned, saying that the leadership of the municipality or city of Windhoek, they should now to start engaging the vendors, more especially those who are selling alongside the streets, to give them information that, okay, dear vendors, we are not able to open all this open market. We are only going to open 4, but the measures that we put in place is that people have to register and then they have to rotate. You know, we say a number of vendors will come Monday, then the others will come Saturday, Tuesday, Wednesday, and so on, to allow each and every one to have, space so that that person can come also, sell something and earn something. Yes, to build some more open market. I agree with the caller. Yes, I'm also encouraging councillors that you should identify more places closer to the people. I've visited the area like Havana. That area is an overcrowded place. City of Windhoek, make sure that you put up an open market there. But before you put up that, engage the community. Where you ask them, where do you think we can put up an open market? Because sometimes, councillors decide for themselves. Not the open market, go this side. But that place, there are no market. People will stranded. As a result, it will force people to go and sell alongside the street, which is not good. And then by, selling in the street, that's how the law enforcement start to crash with the community. And that's what we need to avoid. So I agree with the caller that we need to identify more places. I just wanted to add on the other point that was just mentioned, the type of essential goods to be sold now at the open market currently during the time of COVID. We are talking about the fresh or cooked vegetables or fruits. We are talking about raw or cooked meat or fish. We are talking about dried food. We are talking about dairy products. And we are also talking about raw and cooked poultry products, cereals and flour products, and ready-to-eat cooked food. These are the type of essential foods that we are expecting to be sold now at the open market. However, we are saying people cannot come and cook this time around at the open market. No, not this time around of the period of COVID. But we are saying local authorities should provide a facility at the open market for warming of food. Because if I bring cooked food from home, this food can stay there for hours. And then if a customer comes there and then want to buy a cooked food, the food are cold. It's no longer quality food. So this is what I'm appealing to all local authorities to ensure that there's a facility there provided just within the open market. If you want to warm up food, then a vendor can just go there and then warm up the food. So I just wanted to add on that.
Thank you, Honorable. Before we get to the rest of the responses, we have one last caller.
Caller?
Yes.
Yes, you may go ahead. Good morning.
Morning to all. My contribution, one is on the open market. Some of them have been paid the fee. Secondly, we have also observed that many workers, and by extension Namibians, have been set out of their renting rooms where they are renting. And there was various submissions to the government that the municipality has to subsidize the services, all services to all the citizens to a maximum of 80% during this state of emergency period. And if the services are subsidized, then automatically the renting fees could also be reduced so that those people can remain in the house. But we observe that now the Ministry of Local Government is silent in this kind of thing, and they are doing nothing except saying that they are giving free water to the informal settlement and opening the already closed water so that the debts can accumulate further, meaning that the hands that the Ministry of Municipality is extending is completely out of order and need to be improved. And that's why we want now the minister to comment on that. What about the intervention from his authority that is under jurisdiction in terms of subsidizing the service? Subsidizing does not mean I give you now for free or I will give you now to pay later. Subsidizing means that I give you now for this period, you only pay 20%, the 80% the municipality, like all the other institutions. Social Security came on board, Ministry of Finance came on board. What about the municipality? That is my question to them.
Thank you. Thank you very much for your question and contribution. We have one last question from Media Houses. Yes, sir.
Hi, good morning. I am Andreas Makuti, representing Klein Windhoek Valley Rotary Club. My question is, we do have the opening of the open markets. And now the produce that are to be sold at the markets are mainly sourced from the northern part of the country. Is there a way then to control, or are they going to be allowed to bring this produce to Windhoek? And if so, what are health measures being taken to ensure that no any other communicable diseases are passed through this kind of produce, since they are coming from the soil and so on?
That is clear. Thank you very much. We have another question?
That will be all. Thank you.
Okay.
From the north.
Good morning. My question is to the leadership of all the institutions and to our government more specifically. We wanted to know, the government seems to be fighting this COVID fight alone without a lot of developments in terms of hygiene applications and innovations that were done locally by local manufacturers. We want to know what is the government doing in combination or collaboration with the private sector to see how they can alleviate or minimize the risk of COVID-19 now that we are going into to lease or minimize the lockdown. What mechanisms are there, or what programs are there to join the private and the government within these initiatives? That is my question for now. Thank you.
Thank you very much. I have also questions from our email. There are questions around salons, but I think Honourable Minister touched a little bit on that already, that essential services are the only ones to operate, and therefore salons perhaps as a service will not be given opportunity to operate. So now I give over to Your Worship to respond to some of the questions.
Thank you very much. Let me start with informal traders. For example, Honorable Muinyangwe indicated to ladies and gentlemen who are selling next to the street or those who are using wheelbarrows to sell cones. Yes, this one is just strengthening the question or the proposal made by the caller, seconded by Honorable Minister Utoni, to say Windhoek municipality needs to build more open markets. And this already the Honorable Minister indicated to us that we need to bring in other people or other institutions, be it private or government, so that they can help councils to build many open markets. Another question regarding how much money we get from our open markets. I have to be honest with you, at this point in time, I do not have the total and I cannot give it to you as a result. But I have to acknowledge that from now onward, we have to be serious, all of us. Serious, I mean, from the Windhoek Municipality Council, we will make it a point that we will do all what is necessary to be done from administrative point of view, and then you must make the open markets working, meaning you have to monitor, you have to make the users pay what is due to them, for us to be able to have money to maintain those markets. Otherwise, if we allow people just to go there and we don't make them pay what is due, we will not move forward. As a result, we might not even be able to build more open markets. Next one, access to water. Of course, all our open markets have water, but I think here the access to water was asked by one of the callers, that the way forward now after COVID-19, what are we going to do? How will we provide water to especially informal settlers of Windhoek? I am very happy that my honorable minister is here. We will talk about it. And the problem, what was mentioned, we opened some water of defaulters. So they already owed us money, and we are adding again to what they have owed. How are they going to, how will they be able to pay what is owed to municipality? I think it's for us to take it further to say, Ministry of Urban and Rural Development, and I am very happy, is it not that from NAM Water, the CEO is here. We have to look into this matter. If there will be some money to be given to all local authority so that each and every user of water will not be billed for any water used during this period starting from 27th March until where we are going to end. That will help us a lot. If that will not be done, I do not see any problem being solved. I want to move to ourselves. Why people are moving around and selling wherever they found there is a space. As I said, our bylaws, we must put them in place, because laws are very clear in municipality that municipality in the first place avail places for your residents to operate or to sell from. So again, it's back to us. It is our responsibility to make places available. As Honorable Minister said, we have to involve the private sector and we have to communicate with community so that we get the proper sites where we build the open markets. Another question, not a question, but maybe let me just to impress on local authorities to provide warming facilities. I do not want to go saying, yes, we are going to do this. But what I'm saying is, yes, in consultation with the sellers themselves, we will see how we are going to handle this one. As the question of money was asked, the gentleman didn't want to say, we do not have much money as Windhoek municipality. But he is right. We do not have much money to provide all what is needed, but in consultation with public, private, and other individuals, we will make it a reality.
Thank you very much, Your Worship. Honorable Munyangwe, just in your responses, there was a question from our email address around if the ministry will be doing, in its efforts of the mass testing, will be testing traders and customers at random now that we are reopening the markets.
All right, thank you very much. But before I come to that question, while we are discussing the access to water, from a public health point of view, access to safe water, and I want to emphasize, it's not only access to water, but access to safe water. It's very critical to us because we are keeping on saying people should wash their hands. They need water to wash their hands. People need water to drink because when they have enough water, it helps them also to hydrate their bodies so that they can prevent any waterborne diseases when they have to take contaminated water. Mm-hmm. And there was also a question of people bringing in stuff that they have to sell at the informal market from other parts of the country? And how do we make sure that they are not bringing in, diseases along? I want to answer that at the moment, with the lockdown, people are not allowed to travel from one place to the other. We know that besides the 14 regions, the country has been also divided into zones. So at every checkpoint, at every roadblock, there are also health workers. And people are making sure that whoever is passing, you have the necessary permit allowing you to travel. So at the moment, people are not traveling. So I don't think that people are bringing in stuff now to sell at the informal market. And the other question was?
Testing.
Testing, oh yeah, okay. Of course, we said we want to maximize and fast track on testing, because that's also one way that will help us to see whether we have any community transmission or not. So I don't want to dwell into that one, because NIP, it's busy now with developing a program as to who and when are they testing where. So, and I'm sure that communication will be, a communication will be issued with that, to that regard. So, but of course, we want to maximize on testing, yes.
Okay, final remarks. We have run out of time.
Okay. Okay, maybe as a final concluding remarks, I would like to applaud the Honorable Minister and also our Ministry, Health and Social Services, and other, the local authorities. We have been working on this for the past 2-3 weeks now to make sure that our markets are in proper condition so that they can open up for our people to start selling, because we realize the impact on them as well. And let me also tell you that I'm sure that the training and education has an impact on the vendors, because I remember one day when we were at Oshetu, the vendors were there and they were like, we don't want to come back and sell because we don't want to get corona. So now they also have learned and they know that it's very important for them to practice hygiene. And as a final remark, I want to say that COVID-19 is not over yet. So therefore, we should not start relaxing. We should continue to observe all measures as outlined in the regulations. We stay home, we minimize our movements, stay away from crowds. Of course, washing our hands, because washing hands, it's not only preventing COVID-19, but it's also a practice in preventing any other diseases. So thank you very much. Those are my concluding remarks.
Thank you very much, Doctor. We now move over to your worship. Your final remarks.
Thank you very much. All I am saying is, together, let us seize this opportunity. Let us look at the good things which we can do so that we improve our livelihoods together. There is a need to work together so that each one of us can achieve more moving forward. Thank you very much.
Thank you. Your Honorable Minister, final remarks.
Yes, but I wanted to respond on the question.
Of course.
By the caller. Yes. The Ministry of Urban and Rural Development is not silent when it comes to the provision of potable water. So we have issued directives, and regulations are clear that all local authorities and regional councils has to ensure that their residents or residents in their respective local authorities or jurisdiction of the regional council have access to potable water. Mm-hmm. That one is clear. So And we are saying people who have their water suspended, might be some time, or have arrears, and their water are closed, the directives are clear that this water should be reconnected. And majority of people as well in the informal settlement who do not have access to potable water, these people are supplied with potable water.
Okay.
And that one is taking place. In the city of Windhoek, I've observed myself that a number of taps, because people were even using this card, I think they call it a prepaid card, something like that. Now those cards are removed. It's just like free water now. Most of every citizen in the city of Windhoek, and also outside the city of Windhoek, countrywide, are now supplied with running water, either with a standpipe or with a water tank or whatever means. So what we are saying is, yes, as we all know, as Namibia does not have enough water. We are all struggling. And it's good that NamWater is also listening here. They are here, CEO here. We are saying now let's cautiously use this water with caution, because if we just use it the way we think, it's free water, tomorrow it's going to be a burden on us. So we are saying, please, now this water that are being consumed, we have informed the regional council, the local authorities, to accurately record this consumption or the cost. Now, when these costs are recorded, they should also be put separately, should not be mixed with the normal operation of a billing system. Thinking that if we have the total cost of the consumption during the period of COVID, government will look at it and then see how they can also come in to assist.
All right, Honorable Minister. Final remarks.
Thank you very much. I just want to say that as a nation, let's work together. Let's help our leadership. They are trying their level best. They hear what you are saying, only that challenges are the resources. But if we put efforts together, as we are saying, maybe private people are not coming. Private people are coming in. They are helping. MTC came in, NamPower came in, NamWater came in, Social Security came in. So let's work together as a nation. It's our country, it's our nation. There's no one who can come and help us to rescue us from this situation. Let's put hands together, and I thank you.
Thank you very much, Honorable Minister. Viewers and listeners at home, that brings us to the end of our session this morning. Catch us again at 4 o'clock as we give an update on cabinet decisions. As you may be aware, and I echo the sentiments of the Honorable Minister Utoni, that cabinet ministers are continuously meeting to ensure that the solutions in every sector are actually found to ensure that we all survive this COVID-19 pandemic. That is all from us at the Communications Center. Have a blessed day.
and I'm a doctor. So I hope you're watching this from the confinements of your home. And if not, you should probably go home right now. Help us to fight COVID-19. And to do this, you can take simple measures. There's good hand washing techniques. You can also wear the appropriate protective gear, and then self-isolation. Now, I know that self-isolation sounds like a nuisance, but you know what's worse? Contracting as well as spreading the disease. So help us in fighting this disease. And finally, be responsible. If you're having symptoms, call the hotline and then go for testing. Help us to fight this.